Hello everyone, my name is Deepali Dayanand Chavan. I am going to discuss other beta blockers. So let's start with classification. Beta adrenergic blocking drugs. It includes first generation, second generation, and third generation. First generation include propranolol, timolol, sotalol, and pindolol. Second generation include metoprolol, atenolol, acebutolol, bisoprolol, and ismolol. Third generation include labetalol, carvedilol, celiprolol, nebiolol, and betaxolol. Let's see individual drugs. First, sotalol. Sotalol is a non-selective beta blocker. It has additional potassium blocking property. Timolol. It is the first ocular beta blocker to be used topically for glaucoma. Pindolol. It has been used primarily as antihypertensive, which may be advantageous in patients who have developed marked bradycardia with propranolol. Then metoprolol. It can be used in patients with asthma, peripheral vascular disease, in which propranolol is not used. Then atenolol, acebutolol, and bisoprolol. Because of the longer duration of action, once daily dose is often sufficient for about 3 drugs. Ismolol. Ismolol is an ultra short acting beta blocker. It has been used to terminate supraventricular tachycardia, episodic atrial fibrillation, and arrhythmias during anesthesia. It is it also very useful for reducing heart rate, blood pressure during and after cardiac surgery. Then nebiolol. It is a third generation beta blocker having additional alpha blocking property. It thus causes vasodilation and has the potential to improve endothelial function, which may delay atherosclerosis. Uses of beta blockers are hypertension, angina pectoris, cardiac arrhythmias, myocardial infarction, congestive heart failure, pheochromocytoma, thyrotoxicosis, migraine, anxiety, and tremors. Now let's see alpha plus beta adrenergic blockers. It includes two drugs. First labetalol and second carvedilol. First labetalol. It is capable of blocking both alpha and beta receptors. It is orally effective but undergo considerable first-pass metabolism. It is useful in pheochromocytoma, chloride withdrawal, pregnancy-induced hypertension, and hypertensive emergencies. Most important side effect is postural hypertension. Failure of ejaculation, rashes, liver damage also have been reported. Then carvedilol. It has been used in hypertension and is the beta blocker specially employed as cardioprotective in congestive heart failure. Let's see drugs for glaucoma. Glaucoma is a group of diseases characterized by progressive form of optic nerve damage. This is generally but not necessarily associated with raised intraocular tension. It may be due to increased production or decreased drainage of aqueous humor. Glaucoma is of two types. First, open angle. It is also known as wide angle or chronic simple glaucoma. Second, angle closure, narrow angle or acute congestive glaucoma. Let's see the classification of topical drugs for glaucoma. First, beta adrenergic blockers. It includes timolol, betaxolol, leobinolol, cartiolol. Alpha adrenergic agonists include dipivefrin, apraclonidine, and brimanidine. Prostaglandin analog include latanoprost-like drug. Carbonic anhydrase inhibitors includes dorzolamide and brinzolamide. Miotics include pilocarpine, physostigmine, and ecothiopate. Uh, alpha 1 Alpha 1 adrenal receptor constricts ciliary vessels and reduces aqueous humor production. Alpha 2 adrenal receptor located on ciliary epithelium reduce aqueous secretion. Beta 2 adrenal receptor located on ciliary epithelium enhances aqueous secretion. So alpha adrenergic agonist and beta adrenergic blockers are used to decrease intraocular tension. These drugs act by reducing aqueous production. Carbonic anhydrase inhibitor also act by reducing aqueous humor production. Miotics and prostaglandin analogs act by increasing drainage of aqueous humor. And so, let's see the adverse effect of miotics. First, cataract. Second, spasm of accommodation. Second, stenosis of nasolacrimal duct. Then adverse effect of beta blockers: asthma, bradycardia, congestive heart failure, diabetes mellitus. Adverse effect of adrenaline. Adrenaline is metabolized to adrenochrome, which causes black pigmentation of conjunctiva. Adverse effect of prostaglandin analog include pigmentation of iris, growth of eyelashes, also known as hypertrichosis, and macular edema, particularly in diabetes mellitus patient. Now let's see some MCQs. First, in which of the following condition non-selective beta blockers are contraindicated? Option 1, glaucoma. Then tachycardia. Third, asthma. Fourth, hypertension. Answer is asthma. Question number 2, shortest acting beta blocker is option A, sotalol. Second, aterolol. Third, nadolol. Fourth, ismolol. Answer is ismolol. Question number 3, black pigmentation of conjunctiva is caused by option A, timolol. Option B, pilocarpine. Option C, adrenaline. Option D, physostigmine. Answer is adrenaline. Question number 4, pigmentation of iris is caused by option A, betaxolol. Option B, ecothiophyte. Option C, latanoprost. Option D, timolol. Answer is latanoprost. Question number 5. Question number 5. Which of the following is not adverse effect of miotics? Option A, cataract. Option B, cyclospasm. Option C, stenosis of nasolacrimal duct. And option D, congestive heart failure. Answer is congestive heart failure. Thank you.